Oh, great. I hear that little noise letting me know people are joining. That's wonderful. One of my favorite noises, but I think we'll go ahead and get started, even though there'll probably be a few more joining us as we're underway. So good morning, everyone. I'm Mindy Tueller, and we are in our June UCCCN meeting. I can't quite believe that it's June. I'm actually not really sure what day it is most of the time, but here we are, June 17th, and we're happy to have you join us. So let's go ahead and get started. Oops. So I'll give you a quick look at what our agenda is this morning. We do our usual welcome and introductions with a few announcements and any other kind of housekeeping right off the bat. And then we're going to have a quick reminder that now that we don't have, Zoom meetings, keeping our kids more attentively indoors, that there's that concern about autism and wandering. We'll talk about your brainstorming cases, your resources, your opportunities for motivational interviewing or any quality improvement that you're trying to do, particularly with the backdrop of COVID-19. And then we've got our main topic today is about planning for emergencies, helping the families that we serve to be able to do that, whether it's, a natural disaster or a pandemic or something in between. And then we'll wrap up and we'll try and finish up by 10 o'clock. Next slide. There we go. All right. So this is the time when we introduce ourselves, and it gets a little tricky since we're all on GoToMeeting. And I'm mostly seeing your initials. So maybe what I'll do is try and identify you by your initials and ask you to introduce yourself. And of course, we do love to see your faces, although I also get it. So if you don't want to turn your cameras on, no problem. But we would ask you to maybe turn your microphone on, introduce yourself, tell us, with whom you work, and then mute yourself after that. So again, I'm Mindy Tueller, and I manage the medical home portal, and I facilitate these meetings, and I think most of you know me. Linnea, you want to go?
Chuck, were you trying to say something?
I was just going to tell Mindy, if you click that people icon in the upper right, you'll see the names.
Good point. All right. Okay. I'll try and do that.
I'm Linnea. I'm the services support manager for the medical home portal.
All right. Chuck?
I'm Chuck Norland. I'm the director of the medical home portal.
And Erin?
Hi, I'm Erin. I'm the administrative assistant for the medical home portal.
And Gina?
Hi, I'm Gina.
Sorry, there's two Ginas.
Oh, sorry. Okay, Gina Money.
Hi, I'm Gina Money and family advocate for the portal.
All right.
I'm Gina.
The second Gina.
Oh, sorry. I'm Gina Everett. I'm the care coordinator for the Utah Valley Peds in American Fork.
Hi, Gina. It's good to have you. All right. And Patty, do you want to introduce yourself again?
Hi, I'm Patty. I am a care manager at the University of Utah Sugar House Clinic.
Great. We're happy to have you. Okay, George.
Hi, I'm George. I'm a care coordinator with CYSHCN, UNM Basin.
Wonderful. Okay, and then I see somebody else who's just got CYSHCN as their indicator. So probably somebody else from Eric's team, but I can't tell.
It's Gwen.
Oh, it's Gwen. Okay, hi Gwen. You want to?
It was on my computer. I don't know how to change it or haven't taken the time, but I work with Eric's team as a care coordinator, and I cover Carbon, Emory, and Grand counties.
Great. Wonderful to have you. Okay, Natalie.
Hi, I'm Natalie Allen. I'm the nurse practitioner for Eric's team, and happy to be here.
Great. Okay, Heidi.
Hi, I'm Heidi Bates. I am the QI coach for one of the QI coaches for UPIC.
Great. And Heidi's going to talk to us for a second this morning too. Linda.
Hi, I'm Linda. I'm the care coordinator with Eric's team down in Central Utah in Richfield.
Wonderful. Glad to have you. And Kelsey. You can see that Kelsey is on a mobile device, so I don't know if that's a little harder for her to unmute. I know Kelsey's with Eric's team as well. Kelsey's in the Blanding area. All right, Kelsey, if you're able to unmute and talk a little bit later, that's great. Otherwise, no worries. Hey, Jade, do you want to introduce yourself?
Hi, I'm Jade with Pediatric Care Management with the University of Utah Health Plans and Health EU. And I have another meeting in like 18 minutes that I will have to go to, but I wanted to join in while I could.
Wonderful. Yeah, we know it's always a difficult thing for you with all your scheduling stuff. So we're glad to have you for a few minutes.
Oh, thank you.
All right. Hey, Jill, do you want to introduce yourself?
Sure. Hi, I'm Jill Connor, Director of Business Development at Shriners Hospitals for Children here in Salt Lake City.
Great. And Pat Rowe.
Hi, I'm Pat. I'm Nurse Care Manager with Select Health Insurance.
Great to have you. And Tony.
Hi, I'm Tony Estrada with Integrated Services Program in the Ogden office.
Wonderful. And Katrina.
Hi, I'm Katrina Jensen. I'm a project manager with Intermountain Healthcare, Pediatrics, Children's Health.
Great. And Nikki.
I'm Nikki. I'm a registered nurse, care coordinator at Busy Bee Pediatrics in Bountiful.
Great to have you. And Eric.
I'm there, late joiner this morning. My apologies, technical difficulties. Eric Christensen, I am the program manager with Utah Department of Health Integrated Services.
Great. All right, and then we had a caller one. I'm not sure if we know who that is or if they know who they are. Sometimes it can be a little hard to see that kind of information, but if you're on the phone, great. Yeah, please tell us who you are. Looks like you unmuted, so I'm not sure if you can tell us who caller one is. All right, that doesn't seem to be.
I unmuted them.
Was someone going to talk? All right, not sure what's going on there, but let's see. Tia. Tia, we're happy to have you. Do you want to introduce yourself?
Yeah, sure. Sorry, I'll get you video. I'm Tia Dickson. I am a nurse in the ER at Primary Children's, but I'm here representing EMS for Children as their nurse clinical consultant.
Yes, and we're so happy that you could join us this morning. Thank you very much.
For the invite.
All right, well, I'm not sure if I got everybody. I think I did pretty close, but if you want to chime in at this point and let us know who you are, you're welcome to. Otherwise, I think I'll just ask everyone to go ahead and mute themselves unless you're talking. If you're able.
Can I get one of that ear loops? Oh, of course. Thank you.
Maybe I'll go ahead and mute everyone.
Good morning.
Good morning. How are you?
All right, so I've gone ahead and muted you, but you should be able to unmute yourself if you would like to make a comment or if you're up to speak. So, all right, well, let's go ahead and get started. So we've mentioned this before, but we think the best experience that you'll have for our GoToMeeting meetings, which seem to be what we do these days, is really via the computer. You can always do it just by phone, or you can do it by phone and computer. But as long as you have that visual part, I think you'll have a better experience. And we're going to try and be respectful of your time and end promptly by 10. All right, and some announcements include that next month's meeting on July 15th is going to be our motivational interviewing meeting. So we're excited about that. It's the first of what could be a couple or a few in a series. We'll see what people's interest is. But the very first one is going to be kind of an introduction, an initial big look at motivational interviewing. So maybe a refresher for some and new to others. And it's going to be by Dr. Brad Lundahl, who is a psychologist at the University of Utah, but also has a company that he runs that does motivational interviewing training. And so it will be online, it will be live, and we'll have our usual kind of opening announcements and a little bit of brainstorming right at the beginning of that meeting, and then the bulk of it will be motivational interviewing training. So we hope that you can join us for that and plan for an extended period of time that day. All right, a few other updates include what we've been doing for content on the medical home portal. We've had a lot of stuff going on in our clinical content. We actually have a couple of brand new pages. I think they might be of interest to you. Sexuality and children with disabilities, and also a page about home ventilators. And then we've done updates to our Fragile X module, our spinal cord injury module, our autism spectrum disorder module, and our anxiety disorders module. And then for parent and family focused pages, we've updated our appealing funding denials page. So this is a pretty good and helpful one, I think, and it has a link to our very popular letters of medical necessity page with examples of how to write those. So we encourage you to take a look at that, and that might be useful and helpful for the families you serve. We've also updated our Cornelia de Long syndrome FAQ page written for parents, and we have a number of other FAQ page updates that are right behind, so we'll have more to announce next month. And then we've also just updated our planning for emergencies page, so it's ready for this meeting. All right, Heidi, do you want to talk for just a second?
Yeah, sure. I will start this. So I just wanted to touch base because we're getting into summer, and this is kind of a new normal for kids that have autism. And with my son, it's been a little hard. But just, you know, they say 49% of children with autism either wander or elope, so that's a pretty high percentage. And they do it around, it is usually a form of communication. I want, I need, or I don't want, like when they're scared. For care coordinators out there, I think it's very important to sit down and talk with your families that have a child that have autism about wandering. And sometimes they don't wander at first, but then as they get older, they start to wander because they're getting older. Their minds are getting a little bit more inquisitive. You know, the other thing is always make sure that they enroll in swimming lessons. My son, he knows how to swim. He's not the best swimmer, but does know how to swim because I think it's like 90% of deathly outcomes comes from drowning. So that's make sure that they get in swimming lesson. And then also just make others aware, you know, notify the neighbors, introduce the child to the neighbors, just say, hey, he wanders, you know, also take them to the local fire department, the police department, introduce them. Trust me, my Murray City knows my child well. And they've been fantastic and great. So, and then also there are what do I want to say? I call it a dog collar. It's not a dog collar. It's, I can't think of the name. It's a tracking device. And it's not really, I mean, some kids will wear it like around their wrist, but if they have sensory processing, they won't. But there are things out there that families can get that can track. So, is there any questions? This is just near and dear to my heart, and I think it's pretty important, especially for families that have kids that have autism, that they become aware that this can happen, and they need to be prepared. There'll be Ready booklet, and I have access to that, and I can send it to Mindy, and you can put it on the portal. I think maybe I already did, but it's pretty good, and you can print it off and give it to the families. There's a checklist. Is there anything else, you guys? Any questions, anything like that?
Heidi, thank you. I was looking over the little handout that you sent, this one, and recognized that so much of what is in here is going to be so relevant for our next discussion on, planning for emergencies. So they really go hand in hand. Yeah. So this is great, and we'll make sure that these links get in our resources of the month email, and that should go out in a couple of days. So hopefully that's soon enough if people want to print things out. But certainly contact me or Heidi, and we can get those to you faster if you're interested as well.
Yeah.
Thank you, Heidi.
Yeah, thank you, Mindy.
So this is Gina. Can I just add real quick that we know that at the Parent Center, they get a lot of calls on what to do if they can't afford like an alarm system and such to notify them, like if the front doors are open. We've found that the dollar stores actually have some pretty, for $1, cheap devices that can alarm families to know that the door's been open and such. And so when those usually come into stock at some place, the Utah Parent Center will try to put out through their Facebook pages and such. So that's just an additional piece, because we know that many of us can't afford the really expensive alarms and such. And then just one funny story, I don't know, Chuck, if you remember this, we were visiting with one of the medical homes up north, and one of the parents had told us that their child not only roamed but escaped, and they had the locks and such on the doors, but he could scale the fence fairly easily in the backyard, and they just didn't know what to do. It was a wood fence. They figured out, and they said it works. People might think that, wow, how do you keep doing that? But they put Crisco all over the top of their fence. That helped alleviate some of and so it just shows parents can get pretty creative and such to keep their children safe. But I did want to mention at least the $1 alarms, because it is one of those things for a lot of children with autism and developmental delays.
Wow, you do have to, think a little differently, think outside the box. That's a great idea. Thank you, Gina. All right. So this is your time. If you guys have anything that you'd like to bring up, any cases that you're struggling with, or you'd like to update us on that we've heard about before, we always love hearing the updates. Hopefully they're positive updates and good outcomes. But this is the chance that we get to sort of crowdsource. If there's anything that the folks on the call can help you with, this is a chance for you to put your issues out there.
And just mention that Natalie had asked on the chat whether those handouts are available for providers to order.
Oh.
Do you know, Heidi?
Yes, actually, they are, and they're free. You just have to go, I believe it's to the Be Ready or the National Autism Association website, and you just have to put in your information, and you can actually download the booklet for free, and then they can, then you can print it out as needed. But I mean, like I said, I have it I have it saved in my autism favorites, and I know Mindy should have it as well, so we can send that out.
Great, thanks.
This is Gwen. I have a family that I could use some resources on, and it kind of goes along with the wandering. They're one of my little favorite families. The oldest kiddo is 4, the middle child is 3, and the second child will be 2 in September. I suspect that the 2 oldest have autism. We're trying to, find resources, and they're on the wait list to get tested. And our little guy has just started walking. He's been referred to EI, but that's another story. They're also large kids, so to pick them up and pack them is very difficult. So they're contained a lot of the time. They have a double stroller that they put the youngest child in, and he faces forward, and then the middle child sits rear facing. But when they live in an apartment, so when they go outside, they have at least 2 of the children strapped in the stroller. So I suspect that the baby's motor development has been delayed for lack of experience. And then when they go to the park, they can let one child out at a time, and one parent stays with the 2 that are contained, and then one chases the other who wanders, and inserts themselves in other people's picnic tables, and they both do that. So I'm trying to look for like a wagon that would be heavy duty, durable enough that it could pack all 3 of them. And they're probably, my little 3-year-old's probably 60 pounds, and her brother is probably 10 pounds heavier. And so it needs to be durable, but it needs to have seat belts and harnesses so they can, help transport these kids when they're going. Any ideas?
That is a tough one.
This is Gina. You might want to call the Utah Center for Assistive Technology and tell them a little bit about the scenario, and they may be able to help look and see what there is, especially for the safety issues and such, to see if they have any ideas.
Thank you.
Yeah, they've been pretty inventive and helpful before, haven't they, Gina?
Absolutely, they're a great resource. And if they may not know, they may have some good suggestions of, what to do or what to look for.
Thank you.
Not to dive in here, but I am a twin mommy, and I am part of a group that does, mommies of multiples. And there are some fantastic triple strollers out there that can be extended to 6 seaters. One of the ones that gets the most popular ratings is something, I think it was called SureFold. Sure Stop folding stroller. And those ones get a lot of good ratings from our triplet moms.
Thank you. I have not looked into them. We bought another family a while ago. They were sort of umbrella type strollers that can hook together, so you could use just 2 or 3, but I would need the Husky version for these kids.
Yeah, these ones are designed for special needs children as well, so they actually can be used in schools and preschools.
Perfect. Thank you.
Nice. Okay, we'll look into that as well. That sounds like an interesting resource. Thank you, Tia. All right, great. Does anybody else have anything they'd like to bring up?
Mindy, this is Pat. I just wanted to let people know that over the last month or so, we've had a small team at Select Health looking at our enteral formula policy, and we have, what do I want to say? I'm just thrilled about it. We have opened it up, we've made it less restrictive, and it's going to be very, very helpful for children who, let's say, they're weaning from TPN and trying to increase, oral feeds, or trying to increase oral feeds and use less G-tube feeds, that kind of thing. The restrictions are not as tight, and we've opened that up, and we've also opened up a couple of other enteral feeding formula things that we have those of us that do peds, we've recognized and just wanted to pull our hair out because it was so restrictive. And one of the physicians who does our policies, I emailed him and said, we got to fix this. This just isn't okay. And he has been so receptive, and we're getting ready to submit the final copy. But for those of you that know what a headache formula can be, I think Select Health has done a great job of being willing to open up and make it less restrictive. So that's a win for me. I feel really good about it.
That is fantastic. That is great news. All right. Thank you for sharing. We always love hearing those wins from Pat. They're often pretty impressive.
I know I don't feel like I ever do as much as what you folks do in the offices and when you're working hands-on with the children. So this one made me feel really excited.
Wonderful.
Gina, and that is huge. So thank you, thank you, thank you. That is one of those things, even on the outside, pulling the hair out too for some of those restrictions and policies.
All right, well, hopefully some other plans will take notice too, right?
Boy, I hope so. Through this, I did realize that there are many, many plans out there, many companies that are far more restrictive than we were originally at. Even, you know, our cutoff line was 70% total calories. They've now decreased that to 50%, but with a statement that's open that says, you know, if we're tapering, if we're weaning, kids that have particular bowel issues that need a specialty formula. I was impressed with Select Health's willingness to go out as far as they did. We still are not going to cover over-the-counter formulas. So, you know, I mean, that's just part of being a parent. But the specialty formulas, they're all expensive. But it was a big win, let's just say that.
That is really good to know. Okay.
So we've got a couple comments in the chat. And one of them goes back to the first. These are from Katie. And one of them goes back to the first one about the transportation. You could also try calling the primary children's wheelchair shop and their car seat clinic. They've given me good advice in the transportation area. And the second one is for Pat. That's so great to hear. Can you pass that on to the other payers, which I think we just kind of covered as well.
Right, right. Okay, got him. Okay, does anybody else have something they'd like to mention? No, we also want to hear how you're doing during this strange time. We know that some parts of the state have opened up a little bit more, for better or for worse, and we'd like to hear how it's affecting you. What's going on in your work? Where are you working? How are you working? What are you seeing? So if anyone wants to share that, we'd really like to hear it.
Mindy, this is Jill Connor at from Shriners. Just to take a step back to your previous question related to new resources, we are currently working on adding some new offerings for virtual tours. This new tour that we'll be adding that will be available on our website is related to our Utah Clubfoot Clinic. And that should be up in the coming weeks. So I'll let you know when we have a link available for that.
Great. All right, well, so that's an excellent example of having to pivot and adapt. So terrific. We look forward to that, Jill, and we'll make sure that that link gets on our website.
This is Natalie with Eric's group from CYSHCN, and we, of course, have met some barriers as we've been trying to diagnose autism, because that's difficult to do without being face-to-face. But we are trying really hard to increase our virtual visits to families to be able to help with behaviors and maybe some of those ongoing wandering and some of those things. It's new for us to offer, you know, more of this. We've been doing it for a couple weeks now, and I think it's successful. I think families are enjoying it, and I'm kind of hoping that this is something that will continue even after we can go back face to face.
And so, Natalie, did I hear you say that it's not necessarily diagnosing, but it is providing supports to families?
It has, unfortunately, our clinic kind of had turned into an autism diagnosis clinic just because that was the need of what people that were coming to our clinic. And I've always wanted to add this component. However, with the limited number of providers we had, we weren't able to. So now we are able to do more supportive role, which that's very dear to my heart. And I'm super pleased that we're able to do that. So, and then we're just trying to hook families up to the nearest place that they can get autism diagnosis until we're able to get out and do it again.
Mm-hmm. Well, I guess we do need to look for the silver linings, right? And there are some for sure. So, oh, that's great news, Natalie. Good to hear. All right, anybody else?
Hi, this is Pat. I was just wondering if Dr. Norland had any insight into the COVID diagnoses amongst the pediatric population in general. I don't hear very much about it, but maybe I'm out of the loop as well, because it seems to be more towards the older adult and those that are compromised. Anything that you have to offer, any insights that might be able to help us?
I think the lack of news related to kids is reflective of the relatively low frequency. Kind of changes with age. Kids under 1 year of age are a little bit greater risk, but between 1 and 8 or 10, the frequency of infection is pretty low. People have tried to look to see when they get infected, are they vectors, and their role as vectors, that is, kind of spreading infection to other people, seems to be relatively low. But all of this is actually pretty hard to study because you can't go out and infect kids and then watch them. So you've got to find them, and because they're not very symptomatic, it's hard to pick them up and figure out when they got infected. So, but it is interesting that there's a complex metabolic syndrome that's similar to Kawasaki's disease that has been presenting in kids, particularly in the toddler to middle age adolescent age child that presents 3-4 weeks after infection. That is not usually fatal, but it can be very serious and result in hospitalization. Not very common, but its acronym is CMIS, and you'll probably be hearing more about that. But that seems to be the more serious complication of COVID-19 in kids. And it seems to be the result of an inflammatory reaction that's kind of delayed due to immunity developing, but actually has raised some concerns about, well, if that's due to antibodies, what are the risks associated with immunization? Would that increase the risk of this complex interaction? So more to be learned.
Yeah, it's kind of interesting to think of children's little vectors running around, but that's pretty much what they are, and we don't know about it anyway, right?
Right. Well, anybody with kids in daycare or young kids in school become familiar with that vector concept pretty quickly.
Yeah, thank you. I appreciate that.
Sure.
Okay, great. Thanks, everyone. I appreciate all of that. And we did hear a little bit about quality improvement. Sorry, was someone talking?
Yeah, Mindy, it was Linnea. I was just going to add just a reminder to folks that we have added a COVID-19 page on the portal, which is a little bit different for us than, normally we don't put in sort of breaking news type of pages, but we do have this, and it does have, we have not been sort of developing our own content, but primarily linking to content developed elsewhere. So we do have some information about that, the complex issues in kids and so on, as it's available, which, as Chuck said, is not a lot necessarily at this point, but we've been adding that. And we've also been adding there, just a reminder, we've been adding some resources there on sort of keeping connected and keeping kids entertained. And maybe we'll take a look at adding some of the information about wandering, especially if we can find some information that's specifically around this current situation. But just a reminder to folks that we have that as well. And if they come across stuff that should be there, please let us know. But otherwise, we're trying to keep up with that. Both Utah specific stuff and general.
And since you mentioned that, I realized I reversed the acronym. It's MIS-C, so Multi-System Inflammatory Syndrome in Children.
Right. Okay. All right. Thanks, everyone. Well, let's go ahead and jump into our main topic. And I think we were going to ask for Gina to kick that off for us. Let me pull over the medical home portal and show you the page that we've got on planning for emergencies. And I know that Gina, I'll actually just search here. Gina has done this a lot in the past with the families that she's come into contact with at the Utah Family Center and Utah Parent Center. Maybe make that a little.
Worked on this page as well with staff from Utah Parent Center. And just an FYI, as I refer to the Parent Center and Family Voices, I recently retired from there after 30 years. So I will still say my R, and it's just going to have to be my verbatim for a while until I figure out I'm not there anymore, although I am still on contract to help with succession planning for about the next year. But so we have staff at Utah Family Voices that still works on this, as far as well as Utah Parent Center staff providing workshops and such on planning for emergencies. And of course, this year with COVID, it become much more necessary to really look creatively about what types of information that we were giving out and presenting on, and making sure that those resources were on the medical home portal, because we've always thought about emergencies such as in Utah, earthquakes, floods, on and on and on, some of those natural disasters. Hadn't really thought about a pandemic. So in looking through some of the portal information as a parent, and what we were trying to do during COVID is making sure that some of the key information parents had, and that would be, we all know that on the medical home portal, we do have a care notebook on there, and it may be, and I know it's not on this page per se, but the emergency information form is in that care notebook. And that some of that information that you want to have on in a couple of different places for a child with special healthcare needs, especially a child that may be nonverbal. And maybe some of those key pieces in that care notebook, like if there is a long, extensive list of medications and such. And so I highly encourage anybody to send families that way to look at the care notebook. It might feel a little overwhelming if they look at the whole thing, but there are definitely pages in there to give them good hints and such about information that, in case of an emergency, and there's others, and I always like to say the care notebook really is meant to be that kind of guide to your child in case you as the primary caregiver are not there to talk about all of the things that are, usually in the parents' heads or the primary caregiver's heads, and that it's written down. So there's a complete guide to helping that child if not there. Another piece about COVID that is a little bit different than how we were thinking before was, what if, you know, the primary caregiver gets sick and is not around because they're hospitalized or whatever. So again, the care notebook and the information on planning for emergencies becomes even more vital to have on hand, you know, a copy of those vital pieces of information within the home, always on the child if possible, like in a backpack or something that they have with them, and in the car if the child's being transported by others. So some of this information that we have on there, one of the resources on the main planning for emergencies is the Be Ready utah.gov. There is some great resources on there on things to prepare for, look at, and all of that. Some of the things that come up with families during COVID were some of those things that we think about but don't necessarily realize, and I'm glad the picture of the medications there. We know that more and more, some of the prescriptions are being written for 90-day prescriptions, but not all do. And so a lot of families found themselves with not being able to get out for whatever reason, you know, during the lockdown and such, to have at least a 2-week supply. It'd be optimal to have a month's supply, but not very many can have a month's supply ahead of time. And so we have really helped with some of our workshops and such in telling families if they can't get more than a 30-day supply, you can refill right before that. So you may be having to stockpile maybe 2 pills a month to kind of get up to where you can have a couple of weeks of a supply, because that got a little bit scary for some, especially those, I talk with the hemophilia clinic quite a bit, and their factor. That was another one that was a little bit intimidating, and mainly because even if they could get it, if the doctor prescribed to get more than what was typically paid for in that month, it was the shipping and the long delays and such. So it really made families and us start thinking about all of those things to plan ahead. And I think that's the big thing about, because all children, all families have very different and unique needs. So to give them the resources to make their own individual plans and such, and also having them really read through the Be Ready website, because what became really hard for us as families and family advocates is that we were all in the same boat, and the hardest discussions were that there was this misinformation or misunderstanding about if there are emergencies such as natural disasters, that, you know, there are registries of children and adults with disabilities out there, and the assumption from that was that they would be rescued first, per se, in case of a natural disaster. And those were some of the hardest discussions to have from peer to peer, to say, no, you need to build up your own network. It's great that we have these registries and such, but really this is, you won't be rescued first. And there is, you know, that it's a great resource because we want to know where everybody is and such. But getting back down to get to know your neighbors, because your neighbors, your family, your friends are going to be your first responders, as well as telling them to make sure, and I think Heidi had mentioned it, make sure that your local fire department, EMS and such know about your individual child, their special health care needs, especially if they have pediatric equipment that that may not be on board an ambulance and such, and that that kind of puts some of our families at risk, but it's those hard conversations. And so the fact that we have stuff on the portal, I really recommend that care coordinators and physicians and family advocates really have these discussions, because as we all know from 2020, anything can happen. So thank you.
Oh my gosh, right? 2020, what a year. Right, so I think that was one of the key things that we were hoping to get across, is really this idea that, you know, you want to get to know the people in your neighborhood, the people who will be literally physically closest to you in times of need, and to be thinking about the different kinds of emergencies that might happen that maybe we don't consider all the time. I don't want to say big and small. That's not the right way to characterize them, but there are just a lot of different things that could happen that we don't always consider. And yeah, the care notebook is just great. But gosh, I think this is a great segue to ask Tia for her thoughts on Utah's emergency medical services for children. Right now, we do have a little bit of information on our medical home portal page that's specific to Utah. And so Tia, do you want to jump in now and help us understand what we need to know from that system?
Perspective. I'm happy to. I do have a bit of a presentation, but it says I need to ask you to make me a presenter.
Yes, I would be delighted to make you a presenter. Let's see, it always takes me a minute. Maybe Linnea can do it faster than me.
I haven't used GoToMeeting, so I'm not super familiar with the format here.
Right. And then we should be able to see your screen in just a sec.
Yeah, that looks good. See if it's gonna. Look at that. Can you guys see the screen?
Yes, we can. I think people have the ability to make it a little bit bigger on their own, in their own viewer too.
Okay. And wow, I can still see the chat. That's a nice feature. Well, yeah, so I will go through a little bit and just, Chuck had asked me to kind of explain the program and what we offer. What is EMS for children? A couple of senators and doctors realized that depending on where you happen to be in the US, you could get very different care from your emergency medical services for children. If you were rural, you wouldn't get quite the cutting edge things that they have in the urban environments, etc. So they decided to push some legislation that made it possible to start funding specific education for EMS systems. These are the folks that respond when you call 911 to improve their pediatric care nationwide. In Utah, we have a staff, a core staff of these people here. I'm the one in the middle, but we have a program manager, we have a coordinator, we have a director. More importantly, we have some fantastic resources within primary children. So we have our medical director that is one of the ED attendings at primary in the emergency department. We work directly with Chuck Cruz and the pediatric disaster coordination. And then we have some fan reps that have children with special health care needs that give us the parent perspective. The most important leg of our staff is our coordinators. We try to maintain 2 volunteer EMS, paramedic, or nurses within every county across the state. These people are incredibly valuable to us because they're the voice of that county and a local representative, somebody that you should get to know. And I will take you over to our website and show you how to get a hold of these folks. These folks are linked directly through EMSC and EMS agencies. So they are a great resource, especially for disaster prep, because if they know you're out there, your kids are out there, you might be the first to be rescued, as you said. So that's what we're kind of going for, right? So these are some people that really would be important to get to know. And again, I'll take you to their contact in a moment. One of the biggest things our program is involved in is conducting the Pediatric Readiness Project. This is something that assesses hospitals and EMS agencies on their ability to respond in pediatric emergencies. It's a survey. Unfortunately, it was launched in January 2020, and I can tell you that COVID greatly affected our response rate. So we're going to have to figure out how we relaunch, but it's basically information gathering. It's trying to figure out how prepared each facility in the state is for kids during disasters, for kids during emergencies, trauma, etc. And it's a huge consortium of data that we pull together. And then when we've done this once before, a few years back, then we direct all of our performance measures, all of our program goals on filling the holes identified by this data collection. So that just launched, as I said. We did get, I believe it was just under 50% return rate. The years prior, we had a 100% return rate. So we're going to have to figure out how to bridge the COVID gap, but we are working on that currently. The most direct involvement we have with children and youth with special healthcare needs is our Chirp program. This has been around for a long time, formerly known as the Emergency Health Information Registry for Children with Special Healthcare Needs. How stupid is that name? So we renamed it the Children's Health Information Red Pack Program, or the Chirp program, because our mnemonics are just long enough as they, as it is. And this program has been around now in this form for about 6 years. The program is free. It's a partnership between Primary Children's, EMSC, and the Bureau of EMS. And it's just about making sure that EMS, when responding, have current information for these special kids. This is a case study. I'm going to slide through this really fast because you guys are all familiar, but child with special healthcare needs, EMS shows up. Maybe the person on scene does not speak English or there's communication barriers. The EMS crew looks around and they see that the child has a EMSC red pack, which is part of our program. And they know that they now have all of the pertinent information they need to take care of that child in an emergency. The program provides vials where the kid can attach to their diaper bag, their ventilator, their wheelchair, and it has what we need to know in that moment. It's also a couple of other elements to the program, but in those vials, we keep 2 documents, and these were put together by an advisory board of doctors, EMS, paramedics, nurses. What do we need to know in the moment that that child is having an emergency or an emergent event? And that includes demographics, baseline status, medical history, as well as special needs equipment, anything the parent wants to write that is pertinent to that child. And I really encourage parents in this section, especially with those with autism, to put what their child, what calming techniques they use, what special toys or those things that facilitate their child's behaviors, helps control their behaviors or give them comfort in times of stress. And then we have physicians and specialists. And truthfully, as an ER nurse, this is all I need in the moment of an emergency. I love parents that are so on the cusp and bring the entire book of medical history in with them. I think that's so fantastic, and I would absolutely kind of am already one of those parents. But really, in the moment of emergency, these 2 sheets are all I need. And if those are readily available with the child, then they really make an impact in the moment. So who can be enrolled in this free program? Basically any child with special healthcare needs. These are our our suggestions for children to be enrolled, but I have yet to kick someone out that enrolled because they felt they need to. So I would never do that, of course. But there've been a few, like sometimes we get just the run-of-the-mill asthma, and we did want to do a caveat of asthma with past admission to the ICU because, let's be honest, everyone in Utah has asthma. But for the most part, these are the diagnoses we are going for. What does this program do for EMS and emergency rooms? We do ask the parent to release HIPAA so that the medical information is available. And that way we don't have to wait for some of the CHI or some of the other electronic medical things out there. It's just right there in the moment. The other thing is the system, once enrolled, emails the parent every 6 months to remind them to update their information. So the goal is to keep that information current. What does the program do for parents? This is one of our most popular programs within EMSC because the parent just gets a little bit more peace of mind in being able to leave their child with current medical needs, medication information. So we found that this is very popular with families. Once we send one pack out, we tend to get neighbors enrolling around them, which I think is fantastic because I know that they're tapped into their own communities. And I always like to see that when I've sent one out and then all of a sudden that neighborhood has a little rush of enrollment. So how do you enroll in this program? You basically Google Utah Chirp, or you can go to our website, and that is here. And then you go through these steps. And I actually want to flip out of PowerPoint and take you live. See if I can do that without being too time-saving. This is our Bureau website. And yeah, that looks like it's showing up for you. So EMSC is under the Specialty Care and Access of Functional Needs Program. And when you go to our website, enrollment for CHIRP is as simple as clicking here to our parent area, putting in the child's information to see if they've ever been enrolled before. And I had filled this out in advance, but it didn't save, of course. This is me. And then the system will look to see if they've been enrolled. If they have, it'll say, hey, is this your kid? If they haven't, then I will say create a new sheet for my child. And then the parent has an opportunity to go through these tabs and fill out the information that generates in those two forms. The areas that are bolded have to be filled out before the page can be saved, but they go through and do this and then save for emergencies, which I won't do at this time, but that generates the two sheets and enrolls them in the program. So back to my PowerPoint. What happens then? Their information is reviewed by myself, the nurse clinical consultant, and basically I just make sure that the syndromes are explained and the medications are spelled right. And that's always a challenge for me. I'm looking up those meds constantly. And then the parents are sent out the following: a letter explaining the program. And I do want to note that in that letter, we also refer the families to the medical home portal. We think that is a fantastic resource for these families, and we want to promote you in any way. We also send them to Vials, document Vials, where they can store their health information. And we do print out their forms in case they have any printer challenges. And we send them a red pack, this cute little red bag that they can attach to their child or the backpack or the wheelchair in some way. We also send them a door sticker, and that is something that we originally planned. We have them stick it on the inside of their entry door, and we've trained EMS to come in and look for that sticker. This has been one of the less successful things because we have such a turnover in EMS in general. So a lot of EMS will say, oh, I don't know to look for that sticker, but we have had enough people say keep it in the program that we still send it out. We are still training on it on all of our yearly trainings to look for it, but it's really hit and miss as to whether they do. The nice thing is the program works whether EMS has been trained to it or not. The other thing we do is we ask folks to keep one vial in their home, or not child's home, and we keep it in the fridge. And everyone says, why the fridge? But it is the only mandated appliance in every home. It's actually mandated by law to have a fridge. So we have included a magnet that goes on the fridge or the freezer where they're keeping that document vial. Now, the program's been around for a long while. Let's see if I have any more. The program's been around for a long while, and there is an attached registry. And our goal eventually is to attach that registry to our dispatch system, so that if that home calls for 911, they are going to say, hey, this is a Chirp kid. It would also be a something they could link during an emergency to be notified that this is a Chirp kid. This is a kid with special healthcare needs. The dispatch portion of this program, though, has been put on hold indefinitely for now because, and way before COVID, they recently gravitated the entire EMS computer programs from something called Polaris to ImageTrend, and that put us on hold, and now they're gravitating the entire dispatch system over to a new computer program. So until all of those programs can be in place, that dispatch portion of our Chirp program is on hold. But like I said, the nice thing about Chirp, no emergency provider is going to resist if you hand him 2 pieces of paper that have everything he needs in the moment of an emergency. This can also be helpful in emergency prep if these kids had to go to a shelter or something, you know, in an evacuation situation. To have that information just right there would be so very valuable. At least we think so. That's why we maintain the program. And I'm just flying through all of this because I want you guys to have plenty of time for questions. Other things that EMSC is involved in is we are launching the PEC program. This is a Pediatric Emergency Care Coordinator program. It was actually interesting. Those folks I told you about that represent our county, they've been in place for a lot of years in Utah. The nation started looking at that program and saying, they are doing a fantastic job. I wonder what would happen if we required this in all states. And out of that came our performance measure to get pediatric emergency care coordinators in every hospital in the state and in every EMS agency. The hospitals or the states that launched this program, there were 9 of them, did come back with a written paper, and they were able to show that a hospital having a PEC had a higher compliance with the national guidelines of care for pediatrics, were better prepared for kids in disasters, and had better pediatric outcomes. So they already have good research that this individual, this PEC, makes a difference in the way we care for kids. What do PECs do? This is some of the, I just pulled this from our, you know, how we're introducing this to the state and what we're looking for, but it's basically just a pediatric champion, someone who's passionate about kids, taking care of kids well, and can facilitate education, equipment, training, anything to do with peds, including safe kids fairs, you know, outreach to children with special healthcare needs, all sorts of different programs in pediatrics. And just having an identified person, a point person for that, has shown to improve care. So that's what we're launched on right now. We're working on that statewide. A couple of other resources just for you guys. EMSC Connects is our newsletter. We put this out once a month. It's digital, it's free, and it's everything going on with, number 1, EMSC, number 2, pediatrics in the state. You were talking earlier about COVID numbers for pediatrics. We actually do have some preliminary data, and we have had a section in our newsletter for the past 4 months dedicated to pediatrics and COVID. So I would encourage you guys, Google Utah EMSC Connects, and then go all the way down to the bottom of one of our issues and click this little ghost guy from Pac-Man, and that will sign you up for those newsletters. This month's we're focused on child abuse and recognition of child abuse because we have seen a domestic violence spike in our call volume. Now, this newsletter is directed toward EMS providers. Hi, David. That's my son. Go head on upstairs, okay? You want to play your trains? I apologize. I knew they would interrupt. I knew it. But anyway, following this newsletter, I think will give you it's just a very brief rundown of whatever the hot topic is in EMS. I will say that in this last issue, we did note that the health department has released data, and they've cited 47,000 cases of confirmed COVID in pediatric patients for the US so far. But again, very mild presentations so far, which we like. Other resources, once a month, we do a pediatric emergency and trauma outreach series. This was a live series presented by the physicians at Primary Children's to our state's EMS programs and outreach and pediatricians and clinics and anyone taking care of kids. And it was broadcast via webinar through UTN. It was on the second Monday of every month. Now, we did have to take a hiatus because our building was closed due to COVID, but we are relaunching in a virtual format on July 13th. That will be our next presentation, and it will be ATV injuries. So we are trying to get, and the whole goal of EMSC is to get good pediatric education and information out to our entire state, regardless of what your access is. And that's really the goal of EMSC. Now, I did want to flip out of my presentation here and go back to our website, where was that? Over here. Bureau of EMS, going back down to specialty care, just to point out that down below here, oh, here was I told you that I was going to show you your county coordinator access. Those are the people in each of our counties. So again, these are good people to know. You can shoot them an email, introduce yourself, and just let them know that you're interested in any resources they have. And then down here on our webpage, we also have additional resources for children in pediatric disasters. And all the way to the bottom for children with special healthcare needs. And you know, you guys actually are a fantastic source of that. Be Ready Utah is kind of my go-to whenever I'm focusing on pediatric disasters, but I do like these resources as well for specific to Utah things that we are doing. And that is my summation, very quick, sorry I talk fast, of EMSC. So what answers or what questions can I take from you?
Thank you very much. That was outstanding. So for the when the family signs up with Chirp, is that information available in any other way to EMSC, or is it only through those pages that are available in the home?
They are the information of that is recorded is kept in a registry that we plan to use when we marry our program to the dispatch center, but otherwise it's absolutely HIPAA protected. So there is no outside access of other agencies.
And I know we've talked about the option of that being available through the CHI. Is that still an ongoing effort in any way?
It is. The thing is, the delay has been on the CHI side. We've told them that we are ready and willing to again marry that information should they need it with parents' permission, but they haven't yet they're not ready yet.
Okay. Thank you very much.
So
while other people are oh, sorry.
Go ahead.
While other people are gathering their questions, I was just gonna say, read what Katie said in the chat, which was that she's an EMS provider in Salt Lake, and it's a passion of hers, and EMSC is a great program, and their eyes truly do start scouring the room for red bag when they go to pediatric patients.
I love that. I love to hear that because we don't get a lot of feedback on how the program is working, although I have had several patients bring their red bag into the ER, and I literally do a little dance of joy when I see it. It's just so exciting. And And that's the thing. We're actually looking at, we've had some funding changes, and we're looking at ways to put put the Chirp program out there a little more, you know, producing some flyers or some public awareness campaign stuff that we can hopefully put out to EMS to take to their safety fairs and their prevention fairs.
And Tia, I have a question for you. So on our Planning for Emergencies page on the Medical Home Portal, and we're in the Utah region, when we head down to the bottom of the page, the resources section, we definitely have the Chirp link right there as well. And I'll make sure that all of the other links that you've provided go out in our summary of the meeting, including the way to subscribe to the newsletter and information on the monthly pediatric emergency and trauma outreach series, etc. But I was wondering if you by any chance know anything about the Utah Special Needs Registry that is a collaboration of Utah 211 and a number of other organizations.
I do not.
I didn't
I'm looking at it because it was actually my understanding that our registry, the one we were collecting for Chirp, was actually in fact this registry, but I'm looking at this related to 211 and I'm not familiar with it. So I apologize, but I don't know.
No, that's, I mean, I didn't mean to put you on the spot.
Yeah, that seems to be more focused on adult with special needs, but
as far as I know, our registry is the only one specific to children with special healthcare needs for EMS. I assume that the Department of Youth and Children with Special Healthcare Needs probably has their own registry as well.
So I have an email into our contact at Utah 211, but as you can imagine, I think they're a little busy right now. So she hasn't gotten back to me in the past week or so. So when we learn a little bit more about this, we can pass it on. My question to her is, you know, where does the data go and what's done with it? And there is a way to designate that this information you're submitting to the Utah Special Needs Registry is for a child under 18. But again, after that, it's not clear what's done with that data.
Yeah, I do remember originally that there was discussion of this being the same program, but honestly, the only access we're allowing to our registry currently is our program to be able to send out the vials. We do again want to send it to our dispatch in some computer format, and we would love to marry it to the CHI eventually, but at this time, we are the only ones with access. And we're not running any data stats on the information.
Great. All right. Understood. Okay. Well, any questions or does anyone want to add anything? Have you had any experience with a family having an emergency and being prepared or not? Things are quiet. Well, that's all right. We'll go ahead and make sure that all of this information is captured and written up in our summary that we send out every meeting. And Tia, if you don't mind, I'll go ahead and send you an advanced copy about your section and make sure that it's accurate.
Absolutely.
Excellent.
Thank you.
Thank
you very much, Tia.
Okay, so let's go back to next part of our meeting. The Utah Parent Center and the Utah Developmental Disability Council have been working on a project to make sure that the many systems that provide some of the same kinds of things throughout the state, or at least refer to some of the same kinds of things, that they're literally on the same page with the terminology. And Gina Money, feel free to jump in here if you have something that you can help explain on here, but let me see if I can bring this over. So this is a Google Doc that they have set up, and we said that we would show it to you all and see if we could get a little, again, a little crowdsourcing going on to help flesh out the number of terms that are on here and add to it as well. So I'll go ahead and read this. I'm not sure if people can see it too well. I'll make it a little larger as well. Words define the limits of our world and can make it difficult to translate services from one system to another. Providing context to various words based on their genesis can help families and individuals translate their understanding and point of reference into the correct system in which they are receiving care. So the idea is that we will add terms and then try and explain those terms based on kind of the system in which they're used that we're familiar. And so you can see that this has gotten started here with dual diagnosis, co-occurring, client, integrated healthcare, peers, etc. So as you're looking at this, if you want to call out anything, I can add it to the appropriate cell, and we love your thoughts on this.
So this is Gina, and I think I've had this discussion with Avery already, is that for a lot of families, yes, when you're looking at applying for systems such as human services or like the DSPD waivers and such, some of the language definitely is different than what is used when you are applying for Medicaid in the Department of Health. And so that's where some of this has come from, in families just being so confused and actually putting maybe the wrong term on applications, which has caused a delay and such. What's missing on here as well is that some families or individuals don't necessarily just have, or may not have at all, an intellectual disability or mental health. It's chronic health conditions. And so that also gets confusing because we're just looking at this piece. And then when we were working on the dual diagnosis project, really realized how different the terminology was when we were talking about dual diagnosis when we were developing the training, because we were really truly talking about those with intellectual or developmental disabilities that also had a mental health diagnosis, where in some of the other within their own agency in human services, dual diagnosis meant that they also had a substance use diagnosis. And so it's just gotten so confusing because of all of the language. And we always talk about this with families. You have to learn so many different languages just to be able to navigate the systems and applying for services or getting resources. So I do believe that there is a component missing that, you know, we really do need to be talking about some of those diagnoses that may not be mental health or IDD.
Okay. So Avery, who actually presented to us back in February, said that I can go ahead and send this link out. It's an editable Google Doc. So if you have some thoughts on this and you want to click on that link when it comes out into the Resources of the Month email, that would be great. I know they would very much appreciate your input and your thoughts on this. All right. Well, I think that basically wraps up our meeting today. We're a little early, which is never a bad thing. Just a reminder again that if you're able, I'll go ahead and update the calendar invite, but if you're able to block out that time on your calendar for July 15th, we'd love to have you attend the motivational interviewing initial training. And just a reminder again that we do have this email address that's for our listserv, and you are very welcome to email directly to it with any questions, requests for resources, that sort of a thing in between meetings. We've had that happen a number of times with quite great success. People are so willing and ready to help. They answer really quickly, and it's a very effective way of doing that brainstorming and crowdsourcing. And hopefully everybody's staying safe and healthy. It's a real crazy time. It doesn't sound like it's getting better or easier, so we need to stay vigilant and careful, and hopefully you're all able to find ways to relieve stress and do your best staying in place. All right, well, unless anybody has anything else they'd like to add.
I'll give one more creative idea for emergency preparedness from a parent that has now a young adult that is non-mobile, and trying to think of ways that if there was a fire or again another natural disaster that they needed to get out quickly, could not get to the motorized wheelchair and such, they always have just one of those sleds, like a snow sled that you can buy, and they keep it either behind the couch, or if they happen to be downstairs, they have it in the basement next to a window and have set up one of their windows where they could actually put him on that and hoist him up or pull him out immediately when there's no time to hurry and look or try to manipulate a very heavy motorized wheelchair. And they've tried it out a couple times just in some of their, what they call their drills, and has held up quite well, even though he is of a higher weight now. So just another one of those where families have gotten creative in how do we make sure that we can react immediately in case of an emergency.
Yeah, really good idea. Great.
I have a comment, maybe it's a question, and maybe this is for, I mean, I know Chuck, so I'm going to throw it out there, but as we start to open up clinics again, and you know, I've read people with intellectual disabilities are at higher risk. I'm not entirely certain of that, except for that I'm thinking maybe their ability to understand hand washing and you know, what you touch, I'm assuming, I don't know, you can give me more information, but as we get closer to opening up, any information that you can send to us about how we can best protect, because our clinics, that's all we see is children with special health care needs. And so just looking at moving forward, how are we going to be safe? You know, what extra precautions, because I do read all the COVID stuff, but I don't feel like it's really directed to our population. So anything you hear, we would greatly appreciate as we look to opening up clinics again.
Yeah, I think it's going to be a big challenge. You know, the kids per se are not at higher risk. They're actually at lower risk of getting serious disease. I don't think it's still known how likely they are to get infected, whether that's different. They seem to be less frequently infected than older individuals, and there's some suggestion that that relates to relative lack of the ACE receptors along their respiratory tract, which and the number, frequency and concentration of those receptors per cell seems to increase as you get older. But they're also, you know, at higher risk to not, you know, necessarily do all the things to keep themselves from getting infected. So, you know, touching things, getting close to people, et cetera. So I think it is a challenge. The risks for serious complications seem primarily related to conditions in particularly older adults. So chronic respiratory conditions, diabetes, hypertension, obesity. Those are probably the biggest risk factors for getting serious, life-threatening infection once you get infected with COVID. So fortunately, those are not very common in kids, but none of that is 100%. So even some very healthy young adults get very quickly in the ICU and die. So there's no absolute predictors there. But we will try to keep anything new on our COVID page on the middle, and we link to general resources there from the CDC, who are continuously updating their information. So that's probably the most reliable place to go, but they may not have as specific information as you're looking for. So if we come across things, we'll post that on that page.
Right, because mask wearing in the autistic child is probably not going to go well. So
right.
All right, thanks everyone. Have a good month, and we'll see you back on July 15th.
Take care, everybody.
Thank you.